After years of clinical practice observing which dietary changes produce the most consistent, most rapid, and most dramatic improvement in patients with benign prostatic hyperplasia, I have identified 3 specific food categories that worsen prostate symptoms more reliably than almost anything else, and whose elimination produces results that genuinely surprise patients who try it. I'm Dr. James Whitaker, board-certified urologist, and today I want to share something that comes directly from 30 years of watching what actually moves the needle for patients with prostate disease. Not from nutritional theory, but from consistent clinical observation of what happens when specific dietary changes are made by men with benign prostatic hyperplasia. Let me establish context before I name the 3 foods, because the context makes everything that follows make sense. Benign prostatic hyperplasia, the non-cancerous enlargement of the prostate gland that affects more than half of men over 50 and the vast majority of men over 70, is not simply a structural problem. It is not just a growing gland mechanically compressing the urethra. BPH has a significant inflammatory component, a hormonal component, and a vascular component, all of which are substantially influenced by diet. The lower urinary tract symptoms that BPH produces are the result of the combined effects of mechanical obstruction, bladder overactivity, and prostatic smooth muscle contraction. Diet influences all of these dimensions simultaneously. The international epidemiological evidence for the dietary influence on prostate disease is compelling and has been consistent for decades. Men in populations following traditional Asian dietary patterns have historically had dramatically lower rates of symptomatic BPH and lower rates of prostate cancer than men following Western dietary patterns. This is not a genetic phenomenon. It is dietary. When men from these populations migrate to Western countries and adopt Western food patterns, their prostate disease rates increase toward Western levels within 1 generation. This is among the most powerful evidence available that diet is a primary, modifiable determinant of prostate health. Today, I'm going to walk you through the 3 dietary categories that I have found to produce the most consistent worsening of BPH symptoms, with detailed explanation of all the mechanisms involved and practical strategies for what to replace each one with. Category number 1, alcohol, in any form, but particularly in the evening. I will spend the most time on this one because it has the most mechanisms and because its removal produces the most rapid and dramatic improvement of the 3 categories I'm discussing today. When I ask patients with moderate to severe BPH symptoms to eliminate alcohol completely for 30 days and systematically track their symptoms, using the International Prostate Symptom Score, which is a validated questionnaire I recommend, the results are almost universally significant. Within the first week, most patients report a reduction in nighttime bathroom trips, Nocturia, that they describe as remarkable. Some patients reduce from 4 or 5 nightly trips to 1 or 2 within 7 days of stopping alcohol. By week 4, improvements in daytime frequency, urgency, and stream quality are also commonly noted. The mechanism for these improvements is multidimensional. Mechanism 1, the diuretic effect. Alcohol is one of the most potent diuretic substances in common use. It suppresses the release of anti-diuretic hormone, ADH, from the posterior pituitary, instructing the kidneys to produce substantially more urine than they would from the equivalent volume of water. A glass of wine produces more urine than a glass of water of equivalent volume. This is physiologically documented. For a man whose bladder is already struggling to push urine past a narrowed urethral outlet created by an enlarged prostate, additional alcohol-driven urine production means more frequent bladder filling, more trips to the bathroom, and more fatigue from the effort of voiding. Mechanism 2, direct bladder irritation. Alcohol metabolites circulating in the bloodstream reach the bladder in the urine and directly irritate the urothelium, the inner lining of the bladder. This irritation produces bladder hypersensitivity. The bladder's sensory threshold is lowered, causing it to signal the urge to urinate at smaller volumes than normal. In a bladder already sensitized by the chronic inflammation of BPH, alcohol adds significant additional irritation. Men frequently describe a noticeably stronger and less deferrable urgency after drinking, and this is the mechanism. Mechanism 3, sleep disruption. Alcohol suppresses REM sleep, causing men to sleep more lightly in the first half of the night. This lighter sleep makes men more easily awakened by the mild bladder pressure that would not rouse them from deeper sleep. Alcohol creates a perfect storm for severe nocturia. Men who stop alcohol sometimes notice that even when they do wake during the night for the bathroom, the trips are less urgent because their sleep is deeper and they sleep through lower levels of bladder pressure. Mechanism 4, hormonal effects. As I discussed in detail in the dedicated alcohol and testosterone video, Alcohol elevates estrogen levels through two simultaneous mechanisms. Men who drink regularly are providing ongoing hormonal stimulus for prostate enlargement. The practical recommendation? Eliminate alcohol completely for 30 days. Track your symptom score weekly. At 30 days, compare to your baseline. In my clinical experience, the improvement is typically significant enough to be immediately apparent to the patient without formal scoring. After 30 days, if you wish to reintroduce moderate alcohol, do so cautiously, keeping it to weekends only, avoiding it within 4 hours of bedtime, and monitoring whether your symptoms worsen. Before I continue to the second and third categories, please subscribe to this channel. I'm Dr. James Whitaker, and this kind of detailed, specific clinical guidance based on real patient outcomes rather than generic advice is what I post every single week. Hit subscribe, hit like, share this video immediately with a man you know who has been struggling with urinary symptoms, and drop a comment right now telling me, how much alcohol do you currently drink per week? Be honest with yourself and with me. This information is the starting point for change. Category number 2. Capsaicin-containing spicy foods, particularly in the evening. This connection surprises most patients because most people do not intuitively link spicy food to urinary symptoms. The mechanism, however, is direct, well-studied, and explains why this connection is not coincidental. Capsaicin, the compound responsible for the heat sensation in chili peppers and related spicy foods, including hot sauce, cayenne pepper, paprika in large amounts, and spicy curries, activates a specific protein receptor called TRPV1. TRPV1 serves as a general sensor of heat, pain, and chemical irritation. When capsaicin binds to TRPV1 in the bladder wall, it mimics the sensation of heat and pain, activating the sensory nerves, lowering the bladder's urgency threshold, and producing symptoms of urinary frequency, urgency, and in some men, discomfort. Men often eat a spicy dinner at 7 p.m., and experience significantly worse urinary urgency and nocturia from 9 p.m. onward, without connecting the two events because the temporal delay obscures the relationship. The practical recommendation? Eliminate capsaicin-containing foods for 30 days, particularly in the evening. Many patients are genuinely surprised by the improvement in evening urgency and nocturia that follows this single change. Category number 3. Processed foods high in sodium and refined carbohydrates, the dominant nutritional pattern of the modern Western diet. This category exerts its effects through the most systemic and interconnected mechanisms of the three, affecting the prostate through fluid balance, hormonal pathways, and inflammatory signaling simultaneously. The sodium component affects nocturia through the fluid redistribution mechanism I have described in the dedicated Nocturia video, but let me summarize it briefly here. High sodium intake causes the body to retain water alongside the sodium to maintain normal blood sodium concentration. During the day, with gravity's assistance, this retained fluid preferentially distributes to the lower extremities, accumulating in the ankles, calves, and thighs. When a man lies down to sleep, gravity no longer has this preferential effect, and this accumulated lower extremity fluid redistributes into the central circulation. The kidneys, receiving this additional fluid load, increase urine production significantly in the first 2 to 3 hours of sleep. High refined carbohydrate intake drives elevated blood insulin levels, and chronically elevated insulin stimulates production of insulin-like growth factor 1, or IGF-1. IGF-1 is a peptide growth factor with direct stimulatory effects on prostate cell proliferation. The inflammatory component operates through both sodium and refined carbohydrates together. The modern Western diet, high in sodium, refined carbohydrates, processed fats, and low in vegetables, fiber, and polyphenols, promotes a state of chronic, low-grade systemic inflammation. This inflammatory state directly worsens the intraprostatic inflammation that contributes to BPH symptom severity. Inflammatory cytokines in prostatic tissue directly stimulate prostatic smooth muscle contraction, adding functional obstruction on top of the mechanical obstruction from gland enlargement. Reducing inflammation through dietary change reduces this additional functional component. The dietary additions with the strongest positive evidence. Cooked tomatoes and tomato products are the most important addition. Lycopene from cooked tomatoes is the dietary compound with the strongest epidemiological association with prostate health, and cooking increases lycopene bioavailability 4-fold over raw tomatoes. Green tea 2 to 3 cups daily for EGCG polyphenols. Pomegranate juice 4 ounces daily. These additions, combined with the eliminations, create a dietary environment that actively supports prostate health rather than undermining it. Your 30-day action plan. Eliminate alcohol completely. Eliminate capsaicin-containing foods, especially in the evening. Replace processed, high-sodium refined carbohydrate foods with home-cooked whole foods. Add cooked tomatoes, fatty fish, cruciferous vegetables, and green tea. Track your prostate symptoms weekly using the International Prostate Symptom Score, available free online. Assess at 30 days against your baseline. I expect you will be surprised. I'm Dr. James Whitaker. Subscribe for weekly medical content. Share this with every man over 50 you know who has urinary symptoms. I'll see you in the next video.